So now let's talk about Parkinson's. Yeah, Parkinson's illness, like we are a little bit familiar with. So Parkinson originally is a doctor's name. He found the illness, then named by his name. For Western medicine, we have a lot of illness like this, like which doctor found the illness and then named by it. Then let's see, what is Parkinson? So Parkinson's is the illness, is kind of abnormal movement. It's basically the disorder is the central nervous system. It's chronic illness, slow development, and then getting more worse and worse. So basically, the patient may have four aspects of abnormal kind of movement. So slow, yeah, kind of a pretty slow movement, and muscle tight. The more clear symptoms, tumor, yeah, trauma, yeah, trauma. So that's mainly people pretty possible. You see the first symptom, trauma. Trauma on the hand mainly. Some people trauma on the legs also. And they may affected with the posture. So that's basically Parkinson. Yeah, Parkinson illness. So we say first symptoms of the illness mainly is a kind of a rolling kind of trauma. On one hand, that's the beginning. So what's truly caused this illness? Still not totally clear yet. But we know that's central nervous system disorder. So then we're talking about Western medicine diagnosis for this illness. So basically, by the clinical symptoms, we're talking about they will have four aspects: trauma and some muscle stiffness and the movement slow and the posture is not suitable. So that's generally is clinical symptoms. And in the pretty early stage, yeah, in the pretty stage, maybe we can find some information. We're talking about hand trauma, but before the hand trauma, maybe we can see some face expressions is different with others, and the movement is different, and the gait is abnormal, and then we find the trauma and other symptoms. So that's basically. And like if we go to library test, so people's like blood test, maybe dopamine levels is decreased. So that's generally we're talking about Western medicine diagnosis. And then we're talking about what causes Parkinson's illness. So still not clear. Yeah, still not clear. some families relationship, but not all the patients have family history. So that means we are not truly clear for what it caused. Maybe something relationship, kind of nutrition deficiency, or maybe patient have other illness and blocking the blood circulation to the brain. And maybe some side effects coming from drugs and maybe cause some toxins. Yeah, carbon monoxide poisoning. So that's truly damage brain functions. So that's lot of reasons, maybe relationship, even brain infections. Not truly clear, not truly clear. Then we're talking about TCM. So for TCM illness, which is named, follow the symptoms, like if patient trauma. If patient trauma, we're talking about the 震颤, so that's Chinese word for trauma. If patient have numbness of the hand or maybe the limbs, which is called 麻木 numbness. And if patient is weaker kind of limbs, so we give another name. So that's basically follow the symptoms. So that's we're talking about. And if patient like a condition truly cause the muscles like a weakening condition and a weakness condition. So that's the condition we call 痿症 or 痿 syndrome, muscle weakness. So that's it is follow what's the mainly patient's symptoms. We put a different illness name here. Then we're talking about the different pattern relationship with Parkinson. So liver indifferency and generally internal wind. So internal wind belong to liver issue for TCI. So that's the different idea here with modern medicine. The modern medicine is thinking about this illness belong to nervous system, CNS disorder. But for TCM, for TCM, that's we mainly thinking about internal wind circulation. Internal wind generally say belong to liver disorder. But this kind of internal wind can cause by different reasons for TCM. One mainly reason, indifference. Indifference can generate internal wind, especially liver indifference. So that's the pretty common pattern. So mainly symptoms, muscle stiffness, and trauma or troubling, hand, feet, or low jumps kind of troubling. Patient possible have some painful situation, and also possible have some numbness on the forelimbs. So generally speaking, symptoms worse after rest. and better after movement. So what that mean? Liver disorder pretty easily cause the qi stagnation, and from qi stagnation cause other disorders. So that truly means liver problems here. Liver qi stagnation, if patient got rest, caused more qi stagnation. After movement, qi stagnation getting better, and the liver issue relieved like that. It is truly opposite to another kind of situation. If we talk about some people like getting better after rest and getting worse after movement, that's truly the condition qi deficiency. So don't confuse these two different kind of situations. And the patient possible have some other symptoms relationship with liver injury, like dry eyes, visions, and maybe emotions, and some dark circle under the eyes, and possible like people easily angry, irritability, and also maybe liver insufficiency, damaged body fluid can cause the constipation, can cause the dark yellow urine, some deficiency heating. So patient's tongue is red, and maybe without coating, or maybe little bit coating there, and still possible traveling. The pulse is very pulse, but yeah, thin, the same. So that's the part liver insufficiency part. So our treatment principle, we need nourishing liver in and also kidney. When we talking about zang organ relationship, especially like zang and zang organ relationship by the five elements, kidney is the water, liver is the wood. So kidney water nourishing liver wood. You can see the plant outside with the water, they grow up pretty fast. So that's promoting. Other words, kidney is the mom, liver is the son. If we try to tonify the liver, we also need to tonify the mom. And also clinically, like liver insufficiency, pretty commonly with kidney insufficiency symptoms. And certainly we need to extinguish the wind. That's mainly wind problems. The formula we use 一贯接is the mainly formula liver immersion or generally immersion formula. Lot of in tonified curves, nourishing curves inside. And another formula we call 羚羊沟藤糖. thus mainly working for extinguish the wind. So combination these two formulas together. So that's for this condition. Acupuncture and masturbation treatment. So kidney 3, south points of the kidney tonify. We say if we try to tonify the liver, we need to tonify the kidney, tonify the mom. And the spleen 6 in tonify. Spleen 6 is the point 3 fold in channel meeting in that area. So truly you use these points, you can nourishing or tonify 3 in channel, including kidney, including the liver, including the spleen. 3 channel meeting there, 3 channel meeting. And the liver 3, liver yuan south points, liver tonify. And the LF4, we can thinking about put the liver 3 together. Generally say meeting, forget meeting. So that's basically we treat for these patients. Weekly combination with the herbs with acupuncture together and get a better result. Then we go to another pattern. Still the pattern relationship with liver. Liver qi stagnation and cause the blood stasis. So this pattern, the symptoms, still have trauma or shaking the hand and the feet or even the head. And this situation mainly happens at rest. And could have more painful situation and numbness condition. So these painful caused by qi stagnation and then cause the blood stasis. And the patient still possible have some other symptoms like hyperchondria, like emotion, easily angry, irritability, headache. So still possible have a lot of symptoms relationship with the liver. And the tongue, tubercular. Tubercular is blood stasis kind of tongue. And dark. So these conditions generally say patient have long-term problems, long-term qi stagnation, then cause the blood stasis. The pulse is thin and very and choppy. So very pulse coming from the liver, choppy pulse caused by blood stasis. So the treatment principle for this one, we still soothing the liver and extinguishing the wind and moving blood and open the channels. The formula we use 正肝息风汤. That's one formula. 肝 is liver. 正肝 means calming or soothing the liver. 息风 is wind. C is activate the wind. So that's especially working for internal wind conditions. And the combination with another formula, 通窍活血汤. 血 is the blood. 通 is open or passing through or moving. Yeah. That's 活 moving. 通 is open. 窍 is orifice. Open the orifice and moving blood. So combination these two formulas together treat these patterns. And you can modify from there by the patient's situation and condition. You can put more herbs to modify. Acupuncture treatment. 除了 this one, especially need moving qi, moving blood. So that's the qi moving. And the gallbladder 34, we can clear some heat from the liver, from gallbladder channel. We also can help in moving liver qi. And also good for tendons. So that's the point. And the spleen 6 still working for 3 in channel. Then we go to difference part. Qi and blood both difference. Then sinners losing the nutrition. And then cause some stagnation. The symptoms, patient pale face and easily fatigued and generally weaker. Sometimes people fear of cold. They always try to put more clothes on. And even don't want to sleep. Maybe have some muscle spasms. And still trembling the limbs. Mainly on the hand, possible go to the feet. And some stiffness. Mainly on the neck and the back. And maybe difficult moving. Could have some sweating, kind of spontaneous sweating, cold sweating, and maybe dizziness, and losing stool, and even possible eating. So the tongue is 跳糖, let it be swollen, and maybe with some teeth mark there. And deeper pulse, thin pulse. So that's the defense part. So treatment principle, tonify T nourishing blood, and extinguishing wind. So trauma belong to internal wind condition and open the channel. So the formula with combination few formula together here. 龟皮汤 generally blood nourishing formula. Blood and tea nourishing. 补阳还五汤 thus the formula go to the channel, open the channel, warming the channel. 天麻钩藤饮 thus the formula working for internal wind condition. So with combination these three formula together working for these conditions. And certainly you can add in more curves, treat these problems. Deficiency problems even more difficult to treat compared with excessive kind of problems. Acupuncture points. So for this one, we're talking about the T blood both deficiency. T deficiency will mainly go to middle jaw. Certainly still working for the blood, but we go to liver breakthrough and gallbladder breakthrough, the liver storage for blood. And also internal wind is liver disorder. So we go to breakthrough of the liver and breakthrough of the liver here. Breakthrough of the liver and blood flow. Bladder 17. Nourishing blood. Nourishing blood. And we're still adding T moving points, moving the T. So that's for this pattern. Then we're talking about the pattern, we say spleen deficiency with dumbness. And dumbness with the phlegm, heat, and generally wind condition. So the symptoms for this one, heavy sensation. People have dumbness condition. The key symptoms, heaviness. So can heaviness on the head or maybe heaviness in the chest. And still possible aversion to cold and chill. That's basically some symptoms relationship with young difference. People poor appetite, losing stool, and the movement have some disorder or maybe troubling there, jacking or cutting. So that's generally we're talking about the spleen T deficiency with dumbness pattern. Pale tongue, moistening tongue coating. Sometimes with teeth mark on the side of the tongue. That's dumbness phlegm. And the very pulse here is caused by phlegm. So very pulse generally say with three common conditions: liver issue, painful situation, Another situation is blind. And the sleepy pulse coming from blind. So treatment principle always still say extinguish the wind and subducing yang because like a liver condition pretty easily cause yang rising and cause problems on the head and transform phlegm, remove dummies and open the channels. So this condition we use the formula 天麻钩藤饮 plus. I believe we're talking about this formula before. 天麻 is the herb name. 钩藤 is another herb name. These two herbs mainly working with wind condition. And also they have some other herbs to balance it, but mainly acting with the internal wind. Acupuncture. Acupuncture treatment. Certainly, we still need moving liver qi and acting with internal wind, that's the wind points, and also result blood. Certainly, you can modify it from there. Like a patient same time have spleen T deficiency, you can add in some spleen points to nursing spleen T or tonify spleen T. Spleen 6 still working. Even spleen 3 原 south points of the spleen still can working. And we have a lot of nursing points and tonify points, like breakthrough points still can help. So that's for the illness we're talking about Parkinson. So basically for this illness, we say early stage with the treatment, we can slow the progress of the illness, like relieve some of the symptoms. We couldn't say we totally cured the problem, but truly we can slow the progress. And maybe with TCM we control the symptoms. Patient not necessarily use Western medicine drugs immediately because Western medicine drugs usually will cause some other side effects. TCM is more natural way to treat. So we use TCM treatment to slow the process. And even patient with Western medicine already, or TCM treatment can helping each other with Western medicine and reducing some side effects coming from the Western medicine. And also for this kind of condition, scapular acupuncture is truly help. Yeah, it's truly help. Go to special area, control the trauma, and also moderate area. So that's truly controlled trauma. And if patient has some balance problems, and also we can go to vertical and hearing area, and also can especially go to leg motor area. So that's basically we can combination body acupuncture with ear acupuncture together. So truly this treatment we need to continue that. And it's long-term treatment. So that's basically about this illness, Parkinson.